Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Systemic sclerosis, and you're looking at its manifestations. So, starting with the skin, the endothelial injury and the microvascular disease causing the chronic ischemia. So, there is endothelial injury as well as the microvascular disease. So, endothelial injury, microvascular disease, and it causes the chronic ischemia. Next, we focus on the alimentary tract. So, in case of alimentary tract, the affected is approximately 90% of the patients. So, it affects 90% of the patient. There is progressive atrophy and the collagenous fibrous replacement. So, there is progressive atrophy as well as a collagenous fibrous replacement of the muscular replacement of the muscular is most severe in the esophagus. So other thing to note is the lower third of the esophagus, it often develops a rubber hose like inflexibility. So the lower two-third esophagus. So lower two-third of the esophagus, it develops a rubber hose. So there is a rubber hose like inflexibility. Next is there is a gastroesophageal reflex. So gastroesophageal reflex means the GER, and as well as the Barrett's metaplasia. So gastroesophageal reflex and the Barrett's metaplasia, as well as presence of the strictures. Next, what is involved is the musculoskeletal system. Musculoskeletal system is MSS. It is hypertrophy and hyperplasia of the synovial soft tissues. So there is hypertrophy and hyperplasia of the synovial soft tissue. This is in terms of the musculoskeletal system. Then joint destruction, if you see, it is not common in the systemic sclerosis, and there is presence of the inflammatory myositis. Next, let's move on to the kidneys. So in terms of kidneys, the most prominent are the vascular lesions. So there is vascular lesions, and the interlobular arteries show intimal thickening. So there is the interlobular arteries, they show intimal thickening. So there is intimal thickening, and as a result of the deposition of the mucinous or finely collagenous material. So this is because of deposition of the mucinous as well as the collagenous material. Then we move on to the lungs. So in terms of the lungs are involved in more than 50% of the individuals, and there is pulmonary hypertension which is present. So pulmonary HTN as well as the IF, that is interstitial fibrosis, as well as the pulmonary fibrosis. Now in terms of the Sjogren's, let's look at the heart. So here in the heart there is presence of the pericarditis with the effusion. So there is pericarditis with the effusion, and there is myocardial fibrosis as well as the thickening of the intramyocardial arteries. So thickening of the intramyocardial arteries. To learn and grow daily like this, please do subscribe.